Hi guys, so reading number 19 is in reference to factors contributing to levels of burnout among sex offender treatment providers. So there have been prior research in this area. It had shown that sex offender treatment providers had felt emotional hardening, they were discouraged by client change, increased fatigue, and frustration. It was also shown that 84% of female providers reported that clients had violated their personal boundaries. Some 51% had been verbally or physically assaulted by clients, and that 62% of providers viewed the criminal justice system less effective since they began working with sex offender clients. So, Shelby, Stoddard, and Taylor used the Maslach Burnout Inventory and wanted to investigate what exactly caused burnout among sex offender treatment providers. So, Maslach used three central components to characterize burnout: it was emotional exhaustion, depersonalization, and feelings of reduced personal accomplishment. So, 86 providers returned their responses to the researchers that rated their responses on 22 different items. The responses measured emotional exhaustion, depersonalization, and personal accomplishment. What they were trying to find is burnout among providers would indicate high levels of emotional exhaustion and depersonalization and lower levels of personal accomplishment. The researchers also looked at the gender of the provider, number of years working with sex offenders, type of facility they worked in, their employment status, whether it was full time, part time, and treatment methods used by clients to see if any of those also would indicate reasons for burnout. So they found that compared to just general mental health treatment providers, sex offender treatment providers reported much higher levels of emotional exhaustion. Also, compared to social workers who also normally work with resistant clients, they found that they had similar levels of emotional exhaustion and depersonalization, but they had higher levels of personal accomplishment. Um, the other areas that were assessed, such as the gender type of treatment, they found no significant levels in those except for the setting treatment, or I'm sorry, the treatment setting, such as inpatient or prison setting. With those, they did find that those who are practicing in inpatient or prison settings had much higher levels of emotional exhaustion and depersonalization and lower levels of personal accomplishment. They say that, it's probably because these clients are forced into treatment by way of court orders. It's not voluntary. They also had areas of concern with this type of setting for personal safety, the high number of sex offender clients, and the type of treatment provided. So these providers also stated that they felt very unappreciated by both their community, their correctional system, and also other peers that do not work with sex offender treatment. So the researchers suggest further investigation needs to be done in order to find out more factors behind burnout, especially in the inpatient and prison setting for sex offender treatment providers. This further investigation could help provide with assistance and training, supporting the providers, find coping strategies, help increase their feelings of safety, and so on. So, discussion question one states difficult involuntary clients, especially those who are sentenced to prison, pose particular problems for treatment providers. Do you suppose the voluntary involuntary client dichotomy would be relevant to the study of burnout in other areas of the criminal justice system, such as drug treatment? That is, would treatment providers who work with clients who are court mandated to attend treatment report different levels on the MBI than those who work with voluntary clients? I do believe that other areas of the criminal justice system would be relevant to this study about burnout, due to the fact that clients that have been court ordered to attend treatment of any kind are not going to be as perceptive to the treatment or the provider as those who will voluntarily go. Like this article also tells us, is that clients in this position pose a possible safety risk to the provider because people in general do not like to be told that they have to do something. Actual or threatened physical harm is a very significant stressor which can develop quickly into prolonged job stress, which is called burnout. So, discussion question number two: what steps can the organization take to enhance feelings of personal accomplishment among sex offender treatment providers? particularly among providers who work within the institutional setting. So I think for a provider to feel personal accomplishment in their career, they must feel safe and supported. This support should come directly from the community, their supervisors, and the facility in which they work. Providers should be asked what ask the facility they work in what they can do to help them feel safer while they're attempting to deliver treatments. Facilities should provide guards when clients are a possible assault risk, and should also make sure that there are other safety measures in place, even for those clients who do not fall in this category. And discussion question number 3. So, some would suggest that burnout is a product of time as well as other factors. The research supported here shows that increasing years of experience significantly affected neither emotional exhaustion nor depersonalization. So, how come treatment providers operating under difficult conditions were unaffected by prolonged contact with clients as measured by years of experience treating sex offenders? So I believe the reason that the number of years providing this type of treatment did not affect emotional exhaustion or depersonalization could be attributed to a couple of different things. One thing could be that they have found a way to cope with the stressors that they are working with under these difficult conditions. The article also states that these providers showed marginally higher personal accomplishment rates, which leads me to believe that they've seen a difference that they make in their clients, which gives them incentive to find ways to cope with their stressors and their strains that come along with their position. The article does not specifically state if these providers care mainly for sex offenders or if they carry other caseloads, which could also be another reason why they do not show an increase.